G'day everyone, it's Tim Leeuwenburg here from Kangaroo Island. I'm a rural generalist. I'm a doctor whose work is predominantly in primary care, but I'm also trained in emergency medicine and anaesthesia. And my work involves both providing elective anaesthesia to selected patients, but also emergency cover for those who have challenging airways, whether that be physiologically, anatomically, or situationally. I also work for a couple of retrieval services interstate on a FIFO basis. So I guess I'm really pleased to be part of the Safe Airway Society. The work they're doing is really important to provide some common themes in airway management across different craft groups. The patient doesn't really care whether you're an anaesthetist, a pre-hospital clinician, an emergency doctor, a paramedic, or an operating theatre tech. They just require that you have the necessary skills to maintain the airway safely. So a lot of the work I'm doing at the moment is providing retrieval services to remote communities in Central Australia. This is challenging. The patients tend to be very sick. We have significant distance to get to these patients. And when we arrive, they present again anatomical, physiological, and situational challenges. So I'm a big fan of something called the Hick-Hyman law. Essentially, the more ways there are of doing something, the more ways there are of stuffing it up. So let's focus on doing the basics and doing them well. And for me, that means that we want our clinicians to be trained using a standardised kit, using a common language for crisis management, for using checklists for procedures that are high stakes, and particularly RSI in the pre-hospital setting. Some of the other work I'm involved in is developing pre-hospital equipment for rural doctors who provide pre-hospital care in their communities. And again, if you think about it, if you have a high-speed rollover out in the country, often the ambulance is limited in terms of available resources, but also limited in terms of treatment ceilings. It's not uncommon to be attended by a volunteer crew or maybe a paramedic who can't necessarily provide an advanced intervention. Now, we have excellent retrieval services in Australia, and their raison d'etre is to provide critical care to the patients who need it. But here's the problem. They often take time to arrive. And in rural Australia, we're talking hours, occasionally even a day, to get to some of these patients. So there's a trauma gap in rural Australia. And I'm also part of something called the Sandpiper Trust. Sandpiper Australia is a charity that provides a standardised pre-hospital kit to rural doctors to respond to emergencies in their location. We have clinicians who are trained in emergency medicine and anaesthesia, and we need to incorporate them into providing pre-hospital care where ambulance and retrieval services will take time to arrive. This is something that happens in the UK and in New Zealand, geographically small countries. And here we are in Australia with our tyranny of distance, and yet we rely upon metro-based retrieval services to arrive. Now, as part of that training for our Sandpiper clinicians, we focus again on doing the basics well. Simple airway manoeuvres, use of second-generation supraglottic devices, and a bomb-proof method to perform a surgical airway if it's needed. So this is some of the stuff that I'm really invested in over training, and essentially for me as a rural generalist, it comes down to having a limited suite of meaningful interventions, having standardised kit, and I don't care if that's in your rural operating theatre, your rural emergency room, or indeed in your pre-hospital pack. And then that's tied together through things like checklists, crisis management algorithms, and a common language to help you function when the chips are down. So I'd encourage everyone to be part of the Safe Airway Society. It's a really valuable organisation, models really essentially what they're doing in the UK with the Difficult Airway Society, and I think it's going to make a real difference to patient safety across craft groups, and that's really important. The airway management isn't just about anaesthetists, it's about many different craft groups doing their best under often challenging circumstances. Thanks all.